Hi, I'm Amanda Riphenburg, and I'm here today to talk to you about my work with the North Missoula Community Development Corporation and the Missoula Community Food Co-op, and how I use the plan change process to inform my work there. So specifically today, I'm going to talk about my work with various programs designed to address food insecurity, specifically a program that I will explain a little bit more in depth in just a bit called the Double Snap Dollars program. It's important for me, or it was really important for me to remember, and kind of really hard to wrap my head around, that working in a community development agency meant that I was working in a macro type program, and that instead of one person being my client or multiple people being my clients, the community is my client. So in that sense, my community would be the low-income residents on Missoula's north and west side neighborhood. So that's where all of these ideas are directed towards. So in January of 2015, the board of directors at the co-op decided that they weren't really fulfilling, their dedication to social justice. And that was a big part of their mission, was to create affordable access to nutritious foods. And they were also struggling to connect with their low-income neighbors. They felt that the community had a perception that the co-op was a bit elitist, and that was definitely not something that they wanted. And so in the engagement process, so the board of directors decided they needed to do more to address food insecurity in the neighborhood. In January of 2015, I started at the end of that month, so just right after this decision was made. And during the first process of the change, or the plan change process, which is engagement, I worked to try and get a better understanding of the issue. I was really new to the food community in Missoula and to the north and west side neighborhoods. So one of the perspectives that I used at this beginning stage was the general systems theory. And it talks about how social issues like food insecurity are really complex. And so you can't just have this idea that food insecurity is caused by this one thing, and so we can do one thing to fix it. I also thought about the strengths perspective a lot. Although the co-op had, and the residents of the neighborhood had needs, they've also had a lot of strengths. So the co-op is centered in right in the northwest side neighborhood, which, as I mentioned, is the community that I worked with in, and it's also one of the poorest communities in Missoula, with rates of poverty and SNAP usage double or almost double for the rest of Missoula. But the co-op is super accessible. It's within walking, biking distance of all the residents in the north and west side neighborhoods, and it also is on a really good bus route, which would drop you off right in front of the co-op. The co-op itself had really motivated members and a supportive parent organization, the NMCDC, that really pushed the co-op to do better for the residents of the neighborhood. And the north and west side neighborhoods are also really known for being cohesive and relying on each other. And so there can be a lot of really great social ties there. Also during this time, I used a lot of following skills. Like I said, I was very new to the food community in the neighborhood, and so I used a lot of rapport building, active listening, and open-ended questions so that I could engage with all these diverse people and stakeholders, like people from the co-op, from the NMCDC, in which both boards actually have residents of the neighborhood on their boards, so that's influence there. Also the Community Food and Agriculture Coalition. We worked really closely with them, both the Clark Fork and the Missoula Farmers Market and the Missoula Food Bank. So during this engagement phase, I was just trying to figure out what the dynamics were, the different diversity, the wants and needs of all the stakeholders, and as well as just policies and positions. So those following skills really aided me well. And then as I moved into the assessment phase, I really thought about multi-causal theory, which explains helps explain the complexities and the layers that contribute to social problems. And so with the food insecurity, it helped me, as I'm looking at food insecurity as a big issue, I was able to understand that things like stagnant wages, unemployment, rising food costs, social isolation, the existence of food deserts, and cuts to the SNAP program can all contribute to the social issue of food insecurity. And so all of those points need to be addressed or at least thought about when trying to create a new program. During this process, I also looked at the community wants and needs. And these were collected not directly by me at all times, but by the NMCDC and the co-op in both informal and formal ways. In 2015, the NMCDC completed a community needs assessment. We've also used census data, which is where I got the stats about the west side and northwest side neighborhood being much more low income than other parts of Missoula. Feedback surveys were also used at existing programs, and there was also a lot of informal conversations with residents that either just happened to wander into the Burn Street Center that we see walking by, and we want to tell them about this really cool new program that we have, or existing program, or people that are connected with the center. Moving into the intervention phase, just due to this accumulation of research, it was decided for sure that a SNAP incentive program was appropriate for the needs of the community. We had always wanted to do a SNAP incentive program. That's what the board of directors thought would really be great, but it wasn't until the first couple of stages of the plan change process were completed that it was deemed definitely appropriate. And so this program, which is to this day called Double SNAP Dollars, works to reduce food insecurity by creating a program that makes healthy, nutritious food more affordable and accessible. So it provides a one-to-one match on all SNAP purchases of healthy food, which are defined as any produce, so fruits or vegetables, and there are some whole foods such as milk, eggs, and a few bulk products that also qualify. The program was implemented at the co-op and also at both farmers markets after lots of research and lots of fundraising. It's also important to talk about that how it was in addition to the NMCDC's other food center programs already. As I've mentioned, that food insecurity is a systemic problem and a complex problem. The Double SNAP Dollars program was never meant to be and will never be just a complete solution, to food insecurity in our community. So it complements the other NMCDC's programs such as Real Meals, which is a cooking and nutrition course for SNAP eligible individuals and families. It provides meals, leftovers, and childcare for participants monthly. The Kids program, which runs in the summer from 3 to 6, which is designed to give children a really healthy outlet during times when they might not have any other productive things to do, and is also a federal food program. So it provides snacks and healthy backpack foods to send home, and the quarterly community dinners, which just are designed to feed the community and to provide an opportunity for social ties to be strengthened. In this phase, I also really focused on the social planning model, which really informs the process. Like I said, the Double Snap Dollars program, as well as the other programs I just mentioned, was created through research and understanding that food insecurity is systemic in nature. And we also used the input from our residents, so we knew that we were creating a good program and a program that would be used. The community development theory was also guiding, and it helps us understand the power of community ties and cohesion, which is really important with food insecurity. And then into the evaluation phase, it's impossible to decide if an intervention was successful without proper evaluations. And so as the Double Snap Dollars program is the program that I work closely with and on the most time, I'm just going to mention quickly about what we did for evaluation with that. It's still a very new program, so although I'm hopeful with preliminary data that it has been successful and it will continue to be successful, it's impossible to say that for sure. However, we are now a network member with the national network Wholesome Wave, and part of our responsibilities as being a member of Wholesome Wave is to report our data, such as participation in the program and redemption of the program's benefits. And through that, the Wholesome Wave is able to generate really complex, dynamic reports that can then be used to influence social policy and influence and strengthen the programs themselves. Just in closing, I want to say that my practicum work at the NMCDC and the co-op has been challenging and rewarding, and has really led to me having a deep understanding of how social work looks on the macro level. Thank you.